Dr. Benda, in what instance would you recommend a root canal? Exactly what is a root canal, and why do so many people say it's so painful?
Okay, let's talk first about the painful part. Pain is no longer really something that we have to deal with so much in dentistry, because there are a lot of tools that we can use to get around that. Number one tool is sedation dentistry. We can have a patient that's nervous and having a terrible toothache and really calm them down and put them at ease. And then of course we numb the tooth before we work on it. We have a wonderful numbing product here that we use, and it'll numb the tooth and definitely put it to sleep before we work on that tooth, on a root canal tooth. So it's a misconception. Pain with root canal is something of the past. Nowadays, that's not really the deal. Root canals basically are removing the nerve from the tooth, cleaning out that nerve tissue, and replacing that space in the root with a different material, something that will no longer cause an infection in that area and just keep the tooth nice and clean.
So removing a nerve sounds like it would be very painful if not for sedation. So I would actually be asleep if I was having this procedure done in your office.
Yes, absolutely. We would want to sedate you. There are a couple of ways to do that with sedation dentistry. It could be with the gas, the nitrous oxide, and it could be with the help of a little tiny pill along with the gas. It works really well. The patient is in a happy place, somewhere else.
Okay, it almost sounds like fun.
It is.
In what situation would a person need a root canal?
Usually people need a root canal because a cavity has gone too far and it's already gone into the nerve of the tooth. Once a cavity has reached the nerve of the tooth, an infection starts inside that area. It leads to a lot of pressure that leads to pain, and that's when you discover that you need a root canal. Another situation is with a cracked tooth. A tooth that is cracked already into the nerve portion of the tooth would need a root canal.
Do you have any special tools here that